Dr. Pramod Kattel, obstetrician and gynecologist from Nepal. I have been working in a public institute in Nepal since last 2.5 years. And during my service tenure, I saw many people suffering from infertility, and we being general obstetrician and a gynecologist could not provide the services in optimal level that we expected and what the people desired. Infertility is a global health issue, and almost 15% of couple in the world do suffer from infertility issues, and Nepal is no exception to it. And as told previously, in day-to-day clinical practices, we encountered 2-3 cases among 10 that we see in our OPD. That's why the problem is magnificent in our setup as well, but the fertility services that we are providing at present in Nepal is in rudimentary form and not even available at rural setup outside the Kathmandu Valley. Being a obstetrician and gynecologist, seeing the patient with infertility and could not be able to treat them was a great challenge, and moreover the services provided were lacking due to lack of specialists and training sites in Nepal, as this specialty is just being developed and we have just few specialists being trained just for few days, and they are generally located within the valley. Infertility is a problem of couples, but females are stigmatized more for being the major cause of the infertility, and they are outcasted, isolated, and they are given violence, and they are tortured by not only husband but also the family members, and they have to live in isolation, and even they have at times they have negative ideations like suicide and tendencies of being violenced by even the other neighbors or other persons, and they suffer from mental health issues just because of infertility, which could have been treated in many aspects in majority of the people. People in rural areas are not well educated, so that if they encounter any problems of infertility, they initially hide the issues, and later on when they get more peer pressure and pressure from the husband and even the family members and societies, then they try to go to the faith healers in the rural areas, and when it does not give any results, then only they will seek the issues for the fertility treatment. Moreover, the services provided are rudimentary in rural areas, and almost they are just treated in basic manner. The process of being outcasted will continue since then she will have to live her life in semi-dead situation. Training that I am currently having at Indira IVF through the help of Merck Foundation is going to help a lot in my day-to-day fertility practices, as I have learned from counseling, patient receiving, seeking their problem, identifying the core issue, and then planning the treatment, and finally even solving the problem through different modes of fertility treatments like IUI, IVF. And this training I can replicate in my country. Like we do have a center in the capital city where IVF services is being started, though ICSI procedure will be started soon, but other fertility services are starting soon. And if not, in the rural areas also we can advocate regarding the fertility issues and encourage people and advocate that it is a treatable issue in majority of the cases, and we need not stay at home or think that it is not a treatable entity. At least I will advocate in the fertility issues and even treat them. After going from here, I will be providing services from the basic like counseling and doing advocacy and IUI as such at the setup where I am working. And if I will get the opportunity to be in the valley, I will be even doing the every modalities that I have learned here, from IUI to IVF and ICSI procedure, so that people at large will be benefited. Merck Foundation, More Than a Mother program, Indira IVF and Nepal Society of Obstetrician Gynecologists gets huge applaud from my inner core of the heart, as they have provided this opportunity so that I could serve the people at large. Merck Foundation, being a philanthropic organization and being the initiator of change which focuses on the developing countries like Africa and Asia, the work done has a tremendous impact that will be seen in the near future, so that we from as a member of NESOG and as a government official and as an obstetrician gynecologist try to thank a lot from the core of my heart to those all stakeholders and the persons involved in this process.